Hi guys, and welcome back to my YouTube channel. If you're new here, you're seeing me for the very first time. I'm a student nurse and my name is Ekemni. So in today's video, I am going to be telling you guys some things you might not know about hypertension. Many people have a lot of misconception about hypertension. Many people have so many superstition. Many people have so many misunderstandings. So I hope that by the end of this video, you'll be able to get some clarifications about most questions or most things that you really did not know or you might have forgotten about them actually. So firstly, you might want to subscribe to this channel so that you'll be getting more uploads from me when I upload videos. It's time to see. Blood pressure is the force of blood exerted on the walls of the artery, while hypertension is when the force of blood that is exerted on the artery walls is too high. I have a piece of book here, a piece of paper that I actually listed out 10 signs or 10 things that you might feel that might make you know that you might be hypertensive. Now, you should not also take it that because you have experienced any of these signs, you have hypertension. If you have experienced any of these signs and symptoms, you might want to visit your doctor or your local healthcare provider so that they can actually check your blood pressure on 2 different occasions and on 2 days. I mean 2 times, 2 days, 2 different days, so that if they get the same results for those 2 times, then you would be sure that you have hypertension. The first thing that I have on my list here is shortness of breath. If you are always running out of breath, you are always gasping for air, you should want to check your blood pressure. Go to your local healthcare providers so that you'll be able to know how to manage it. You should also always remember that hypertension is not a heart disease. It is just something that happened due to something that went wrong in your body. So if it is just that thing and you are discovering it, it will be easy for you to manage it. But if it gets to the grade 2 hypertension, then it might be very difficult for you to treat it. So first things first, when you have shortness of breath, please visit your healthcare providers. The second I have on my list is nausea and vomiting. If you're vomiting for no reason and you're always having nausea, please visit your healthcare provider. Another one is nose bleeding. If you have nose bleeding, like you're just like this and when you cough, it comes out with blood on your nose, please visit your healthcare provider. Another one is severe headache. If you have severe headache and it's coming from this back area, your occipital bone area, that is your backbone, the splits of your head, just know that it has something to do with hypertension. Please visit your healthcare provider. Another one I have is fatigue or confusion. For no reason, you're just tired. There are some people that are like that morning, afternoon, night, whether they work or whether they are not working, they're always tired and they are always like confused. They are not really, they can't really, like, they're always confused. Please see your healthcare providers. Another one is blurry or double vision. This one might actually be happening to older people, but please, when you're having so much blurry or double vision, when you know that your eyesight is very, very perfect, please visit your healthcare providers. Also, most people think that hypertension happens only to the elderly people or the aged people. That is not true. Young people can actually get hypertension. And when I say young people, I mean 14, 15, 16. So you should be careful with hypertension. Another one is fainting. If you faint, if you see anybody that is fainting, the person is not stressed, the person is not under tension, fainting is another sign of hypertension. And then I have chest pain, hypertension. And then blood in urine. So if you pee and you notice that your pee is not pale or your pee is not amber, that's normal color urine is supposed to be. You know how pale yellowish your urine is supposed to be. If it is not like that, it is kind of reddish, know that there is presence of blood in your urine and it is not something you should ignore. For ladies, when you are on your monthly flow and then you pee, there's every tendency that your pee is going to be a little bit like reddish in color. But if you're not on your monthly flow and your urine is reddish, you have to actually go and see your doctor because that is not a good sign. And then you can also experience irregular heartbeat. Irregular heartbeat is also a sign of early hypertension, not ignore. And then sweating too much, perspiration, that is also a sign of early sign of hypertension. And then the last one I have on my list is sleeping disorder. You might be wondering, why is it that when I go to bed, I don't sleep on time? I'm always rolling on the bed for like 3 hours before I finally sleep. That is not good. That is the same a sleeping disorder. So you should actually go and see your doctor to get yourself checked, so you know actually what is wrong with you. And at this point, at this time of the day, like at this point in our life, in this 21st century where everything is just so easy for us to navigate, I feel like everybody should have a manual BP apparatus in your house. BP apparatus is the instrument that is used to check your blood pressure. So I feel everybody should have it in their house. If you don't have it, you should you should go at least once every month for your checkup to know how your body is doing, especially when it comes to high blood pressure. So the next thing I have on my list is what triggers hypertension. This is where many people have many misconceptions about what triggers hypertension. There are actually many things that can make you hypertensive, and for the elderly it comes with age. So one thing that can actually trigger hypertension for both hold, especially for the young people, is your diet. You know, now we consume lots of sodium, which is salt, and we feel it is normal. We consume lots of fatty food and we feel it is normal. We consume lots of, our food intake, there are so much cholesterol in there. So that is why you see a 16-year-old getting being hypertensive, not because he or she is indulging in too much thinking or overthinking as people think. It is because that child, you have been feeding that child with lots of fatty food. Your diet actually plays a huge role in your life. So you should watch and you should be very mindful of the things you take. Like your food intake should be very, very healthy. The next thing that can trigger hypertension is when you have chronic kidney disease. The kidney is where urine is formed. So when there's a problem in the kidney, it will not be able to produce the normal quantity of urine it should produce, thereby causing an increase in your blood pressure. Another thing that can actually trigger hypertension is diabetes. So you should also be mindful of that. That also has to do with diet. When you watch what you eat, you are not going to have diabetes. And when you don't have diabetes, you are not going to have hypertension. So please watch what you eat. Another thing that can actually trigger hypertension is your family history. Sometimes it might be genetic. Maybe your grandmother has it, so there is every possibility that you might have it. But aside that, and then another thing that can actually trigger hypertension, which is it is very, very necessary that you watch out for it, is overweight or obesity. When you are overweight, you are already too big, you are stressing your heart, your arteries are crying out, your lungs, your kidney, every part of your body is actually crying out for help. So when you are overweight or when you are obese, just know that you are at a higher risk of getting hypertension. I drew out how you can actually check your blood pressure. I drew out the normal rates of blood pressure in case you want to go check your blood pressure. I mapped out how you can know if you have a normal, what range is a normal BP, what range is high BP, and so on. So I mapped it out on my book, and I'm going to be leaving it I'm going to be writing it out here. So for a normal, firstly, the BP, you all know that it has two numbers, the upper one and the lower number. The upper number is called the systolic number, while the lower number is called the diastolic number. So for a normal BP, the systolic number, which is the upper number, should not be less than 130. And the diastolic number, which is the lower number, should be less than 85. So anything other than that is not normal. If you check your BP and the systolic number is less than 130 and the diastolic is less than 85, you just have to know that you have a normal blood pressure. So we have also high normal BP. This high normal BP is not that you have hypertension, but it's just that maybe you just finished running and then they check your blood pressure and they get this. So it's not constant. It might actually go back to normal. It's just that you indulge yourself in a kind of to just exercise or walk, then you can actually have a high normal blood pressure. And a high normal blood pressure, it should not be less than, it is between 132. The systolic number should be between 130 to 139, and the diastolic number should be between 85 and 89. And then also we have the grade 1 hypertension. This one is the starting point of hypertension actually. So for grade 1 hypertension, the systolic number is usually from between 140 to 159, while the diastolic number is between 90 to 99. And then we have also the grade 2 hypertension. The grade 2 hypertension is when you have your systolic number as over 160 and you have your diastolic number over 100. So that is just it. I hope that with this chart you'll be able to track yourself and know how you are doing when it comes to your blood pressure. So no matter what stage you are in these blood pressure charts, just know that there is always a management of everything. If you are able to follow your doctor's prescription and you're able to do what your doctor or your physician or whoever your healthcare personnel gives you, you'll be able to live a normal life. Remember, high blood pressure is not a heart disease, so if you manage it well, it's not going to actually cause any harm to you. So I hope that you find this video interesting. If you did enjoy it, don't forget to thumb this video up, subscribe to my channel, and share this video with your family and your friends, your daughters, your children, your auntie, your uncle, everybody. And I'll see you guys in my next video. Bye.